My name is Tom Randolph. I'm an economist here at ILRI. I joined ILRI 13 years ago, coming from the crop side. I was doing rice policy in West Africa, so came and did a switch to animal health, epidemiology and economics, working in a unit here at ILRI, but have then migrated into different posts over the last 13 years. Okay, well, as I said, I started with epidemiology and economics, so looking at animal health issues and delivery of animal health technologies. But then, as we restructured in the early 2000s, I got more involved in animal health and human health issues. So we started a program looking at both the negative and the positive benefits of keeping livestock. So both the nutritional benefits as well as understanding better the food safety risks and some of the risk with zoonosis. More recently, I was then involved in the markets theme, looking more at the issues related to smallholder farmer competitiveness and some of the issues related to delivery of services, inputs that they need to be able to take up higher productivity technologies. Yeah, I guess what I would consider to be milestones for me have been more those related to ILRI's own development. In terms of when I first came, it was for scientists to identify what they wanted to work on, and as long as they could get funding, as long as they could justify that somehow it contributed to development and that it was somehow legal, then they could do whatever research they wanted. As we tried then in the 2000s to refocus our work to be more focused on getting to impact, and Carlos and John trying to rein us back in and to get onto a common agenda, we did get a more coherent strategy with this focus on the pathways out of poverty. And I felt that was a real accomplishment to bring together our research and give it more of a sense. Getting it to actually focus was a whole other issue, but at least we had the right strategy. And now I think as we go into the consortium projects, programs, we're taking it another step in terms of being able to yet again focus and recenter our work and bring it together in a way that may actually translate into more impact than we've been able to achieve in the past. I guess the major change has been the bringing together of the two institutes. When I first joined, there was still quite a divide in thinking and in culture between the old ILRAD and the old ILCA. And I wasn't a member of either one of those, so I was very conscious of it, but I don't think I was part of it. And as we've had to go through these various strategy rethinks and then translating that into our work plans, into our implementation plans, as we call them, there's been more of a bringing together and integrating of the two cultures. And we've gotten, I think, a healthy respect for how the two original cultures now have contributed to a more integrated, unified culture that is perhaps more impact-oriented than it was before. Yeah, what I would see as the future for ILRI would be for us to actually work as teams much more effectively than we have been in the past. And I think the CRPs are again possibly going to help to facilitate some of that process of getting to actually working as a team, solution-driven, where we're interacting and sharing information and our perspectives, whether it be from a laboratory perspective on what diagnostic issues there are with a specific disease, to the social sciences, better interacting with those scientists, saying, Well, in order to make that useful in the field, to control African swine fever better in Uganda, actually that diagnostic needs to be in this format, or we need a diagnostic for market traders to be able to use. That would be very cheap. How would we get there? So I think getting a more continuous interaction between the different capacities and different expertise we have, and that translating now into real solutions, is going to be something new for us.